Calling the 1 o'clock HHS calendar for, first up, we have SCR 15 SR 7 requesting Department of Health State Health Planning and Development Agency to convene a health data sharing working group to accelerate and expand the sharing of real-time health information among healthcare entities and government agencies in the state. First up, we have Jacqueline. Are you? I see you. Come on up in support.
Aloha, Senator Sandpoint Ventura, Chair. We do support this. This is a very important notion, and thank you for suggesting it. I would just share that the State Health Planning and Development Agency has a Health Data Advisory Council now that has HMSA, Kaiser Permanente, Aloha Care, Queens, HPH, and others. We probably are lacking the Health Systems Corporation, and we could have a family physician there and some other people that could help us with this. Because one of the problems with data sharing is for some of the small hospitals and some of the small physician practices, the cost of getting the interoperability up is tough. And so they need some assistance. We're hoping that some federal grants we're applying for will help with that. We support the idea. We'll go forward with it if that's what the industry wants. But we're doing it anyway, and we're happy to issue you a report either way. So thank you very much.
Okay, thank you very much. Next, we have Hawaii State Council on Developmental Disabilities and Support. Thank you very much. Next, we have HMSA and Support.
Aloha, Chair, Vice Chair, Don Carrizo on behalf of HMSA. We will definitely stand on our written testimony, and just want to highlight that we recognize the work is already happening, but we hope that this work continues, and we appreciate the establishment of an official working group so that we can continue the conversation and push our healthcare sector forward. Thank you so much.
Thank you very much. Healthcare Association of Hawaii in opposition.
Good afternoon, Chair, members of the committee. Thank you so much. We did submit testimony in opposition. We agree with the intent of the resolution. We agree with the idea that we should be exchanging data between our healthcare providers, but we do believe that this work is already happening and that we are looking forward to continuing that work and hope to focus on what we're doing currently in the committees and the groups that are in effect. And so we do not think that a new working group is needed.
Okay, thank you.
Thank
very
you.
much. Next, we have Kaiser Permanente in opposition. Okay, thank you very much. Next, we have Hawaii Pacific Health in opposition.
Hello, Senators. My name is Dr. Lin. I'm a pediatric hospitalist and vice president of IT at HPH. We are in opposition to this resolution because we feel it is duplicative and wasteful of resources and time when it comes to information exchange. We support the Hawaii Health Information Exchange as the state designated entity and the proper home for any type of work, as well as national changes when it comes to trusted exchange framework and common agreement is already promoting changes to information exchange through networks of network exchange. So we feel yet another work group would be distracting to the work that is already underway and the national changes that are already occurring, as HPH is going to be one of the first entities signing up for this new national standard starting in May. Thank you.
Thank you very much. Okay, next we have Hawaii Health Information Exchange in opposition. You're it again, Dr. Lin.
Take two, deja vu. Thank you, Senators. I am speaking on behalf of the Hawaii Health Information Exchange as the chair of the board, and speaking for the entity. To clarify, we earlier submitted testimony as comments, but now are in reconsideration are opposed to this resolution. We feel the Hawaii Health Information Exchange has the trust of the community and has been working as a state designated information exchange for the last 17 years. And our organization is already doing the work and did the homework, providing a survey which you and other senators and legislators can easily access, and to identify the financial and technical obstacles that individual providers, post-acute care facilities, and other healthcare entities already have. We endorse the Trusted Exchange Framework and Common Agreement and feel that another work group would not contribute anything that has not already been done or is being done by the SHPTA Data Advisory Group or our own entity.
Thank you very much.
Thank you.
Okay, no one else having registered. Those who are provide written testimony are Department of Human Services in support, Queens Health System. That's a weird sound. In opposition. Yeah, it only started today though. I don't know what's going on. Ahahui Ona Kauka, Association of Native Hawaiian Physicians in opposition. And Dr. Marzo, Hawaii Academy of Family Physicians Legislative Committee in opposition. Anybody else wishing to testify on SCR 15? Yes, Angela, come on up. You have 1 minute.
Aloha Committee, Angela Melody Young on behalf of CARES. Wishing to comment. So testifying in support of improving the health processes and the quality of health in Hawaii for all citizens. Yet I've got concerns. The resolution seeks to share data across platforms to improve health outcomes while aligning with national privacy standards. The goal, page 1, paragraph 2, is health equity and to influence and social determinants of health through the sharing of real-time health data. That is, I think, an inherent contradiction because medical records should never be shared or used to advise public health management for purposes of identifying social determinants of health. So maybe I'm assuming, but the way that the wording of the resolution is presented is in contradiction, I think, to the standard practice in the medical world of the HIPAA Act. As a concerned citizen, I'm worried because when I talk to doctors, they don't even know the HIPAA Act.
Thank you
And
very
it's
much,
not
Angela.
proposed
you.
in the resolution.
Thank you.
So.
Thank you. Thank you. Okay, anybody else wishing to testify on SCR 15? Members, any questions? I do. Dr. Lewin, come on up. Okay, so someone asked me to submit this resolution because I also understood from Dr. Lin and from yourself that you folks are already doing some kind of data sharing. But this resolution talks about real-time data sharing, which is not occurring now. You heard Dr. Lin. Will you folks be able to, without this resolution, be able to move forward with a working group to do the data sharing necessary so that we don't have duplicative working groups and that healthcare providers, when caring for a patient, will be able to protect the data according to HIPAA, but also be able to share so that we don't have contraindicative types of treatment.
Yeah.
I think that's the biggest concern when there's multiple physicians, right? Is that, right? Will you be able to do it without the reso?
Aloha, Chair and Vice Chair. Yes, I think we can do it well without the reso. I do appreciate the comment just issued about privacy. We think privacy is paramount to be protected. We have ways of protecting the HIPAA rights of patients, absolutely. But we also have needs as a state to understand health status monitoring. How are we doing and track our progress and success, and also with public health surveillance. So we think this is very important. The real-time part is tricky and catchy because it's like getting the technology up to speed with what's available now. But I believe this group, maybe with some additional members actually that we should add to round it out, including the family doctors and the nurses and some others that aren't there. I think we can do a good job and get that material to you through the Health Data Advisory Council already formed.
Okay, and is Dr. Lin's group part of your Health
Yes,
Advisor Council?
Absolutely, the health information exchange is there.
Okay, thank you very much. Any other questions? Okay, seeing none, moving on. SR 7 is the same thing, so we're gonna keep moving. Next up, we have SCR 34, requesting the Hawaii Medical Association and Hawaii Psychiatric Medical Association to convene a roundtable to establish medical protocols to ensure an individual's thyroid function is tested before psychotropic medications for mental illnesses are prescribed. First up, we have Hawaii Disability Rights Center in support.
Yes, thank you. Yes, good afternoon, Senator. I'm Lou Erdeshek, the Director of the Disability Rights Center. Thank you for hearing it, and a special thanks to Senator Aquino for introducing the resolution and to Jane in your office for all the work that she did. We really appreciate it. You'll hear from Pauline Arellano shortly, who's a longtime member of my board of directors who first raised this issue. And like you, I'm a lawyer. I'm not a doctor. I really didn't know much about it, but I did a lot of reading and I've talked to people. And apparently, it is a good idea to test a thyroid to see if that's having an impact. And she'll tell you all about her personal situation where her daughter had serious problems, still does. But after many years, they tested her thyroid and found that was the cause of the problem, and that a lot of the psychotropic meds that were administered were not necessary, in some case counterproductive. So psych meds are great but if you don't need them, you don't need them. So we think this is a great idea to get some discussion going. We're not trying to mandate anything, obviously. We just want to have discussion. Thank you.
Thank you. Next, Pauline Arellano in support. Come on up.
Thank you for allowing me to testify today. My name is Pauline Arellano, and this is a picture of my daughter. I belong to many fine organizations. My thoughts and opinions are my own. Hypothyroidism and hyperthyroidism can mimic bipolar disorder. My daughter was misdiagnosed and the results were tragic. She was left in a vegetative state for 8 months. She was given lithium and Prozac. While lithium works well for some psychiatric disorders, it is tragic and toxic for those with a thyroid condition. Psychiatrists will tell you it's not their job to test for a thyroid condition. It should have been done by the patient's primary care doctor prior to being referred to a psychiatrist. Baloney. When you're prescribing powerful life-altering or life-ending medicines, it is your responsibility to do so safely. Don't let this ever happen to anyone again. Clinical Lab is $58 for a thyroid test. Mahalo nui loa.
Thank you very much. Okay, next up, we have Marianne Poyer in support, Mary Pat Waterhouse in support. Anybody else wishing to testify on SCR 34, come on up.
Honorable Chair Senator Buenaventura and Vice Chair Aquino.
Identify yourself.
I'm Dr. Joe Ritter, speaking in support at request and on behalf of Representative Therese Amato, who's on the floor of the House at the moment. Therese is Vice Chair of Human Services Committee and member of Health and Homelessness and Commerce and Consumer Protection. This bill is personal to Representative Amato and to myself and our family. At this moment, Therese's adult daughter, Gabby, is hospitalized with temporary hypothyroid psychosis. She's not normally in need of any mental health care or psychotropics. Due to a long-standing thyroid condition, Hashimoto's syndrome, she has virtually non-functioning thyroid. She moved, started having symptoms. While waiting for new health insurance, she had requested a thyroid test to be done. It wasn't done. She felt ill. She went to the hospital. Treatment was refused. Then she went back after an incident, spent days in an ER unit. They had no idea how to treat her. I understand. But myself and all of my brothers are.
Thank you, Dr. Ritter. Your time is up. Sorry.
Okay, thank you. I urge you to protect victims who cannot protect themselves.
Yes, there's nobody in opposition. So Angela, you have 1 minute too.
Angela Melody Young on behalf of CARES, in strong support. So this resolution ensures that an individual's thyroid functions are tested before psychotropic medications for mental illness are prescribed. Psychiatric, psychoactive, psychotropic medications are medicines such as antidepressants, anti-anxiety medications, stimulants, antipsychotics, and mood stabilizers. Antidepressants treat depression. Prior to being prescribed such medicines, a patient should get checked for thyroid function, otherwise adverse effects will occur. Evaluating for thyroid disease is a medical evaluation in which a doctor could consider prior medical records. The doctor would examine the thyroid and order a blood test or diagnostic tests. A standard examination is done by palpation, feeling the thyroid gland. The doctor feels for the gland and whether masses or nodules are present. And a thyroid ultrasound scan is a diagnostic test that shows a picture of the structure of the thyroid gland, and ultrasounds are most often used to determine if a nodule is cancerous. Although ultrasound is not usually performed as a routine screening test for thyroid nodules in the general population, because ultrasound abnormality can be very ordinary in people with no evidence of thyroid disease. So there
thank
should
you,
be
Angela.
an adequate thyroid
Thank you,
test
Angela.
performed prior to prescribing for
Thank
mental
you.
illness.
Thank you. Anybody else wishing to testify on HCR 34? Okay, members, any questions? Okay, we're gonna move on then. SCR 39, SR 28, requesting the Department of Human Services to convene a baby bonds working group. First up, we have Michelle McCoy, Office of Hawaiian Affairs, in support.
Yes. Good afternoon, Chair, Vice Chair Michelle McCoy for the Office of Hawaiian
Please
Affairs.
put the,
For the Office of
Thank you.
Hawaiian Affairs. We have testimony in support, and we are asking for an amendment to this resolution that would include the Office of Hawaiian Affairs in the working group. Mahalo.
okay, thank you very much. Next, we have Department of Human Services providing comments. Next, we have Democratic Party of Hawaii in support. Anybody else? And next, we have Carl Bonham, University of Hawaii, providing comments. Carl, present? No? Okay, anybody else wishing to testify on SCR 39, SR 28? Come on up, Angela, you got 1 minute.
Angela Melody Young on behalf of CARES and strong support. So being born into poverty could determine what the rest of your life looks like, not just for you, but for your kids and the future generations. Babies born into poverty face limited opportunity and start adult lives at a significant disadvantage. This persistent disparity is a major challenge to achieving systemic equality. Wealth inequality in the United States has reached alarming levels, especially through the lens of racial disparities. The wealth gap isn't about money, it's about systemic injustices like redlining and discriminatory policies that hurt marginalized communities and low-income demographics. The net worth of a white family is 8 times greater than a Black family. Yet shouldn't everybody in the United States have access to prosperity despite being from marginalized communities and racially diverse demographics? Racial diversity, right? And the critical race theory explores institutional structural racism, implicit bias, microaggressions, racial privilege, the relationship between race and class, and racial disparities that affect policy, affirmative action. The criminal justice system, of which has enslaved the racially disadvantaged, has made disproportionately affected cultural groups such as Blacks, Latinos, and
Thank you,
ethnic cultures
Angela.
feel more discriminated upon.
Okay,
So we
thank you,
need
Angela.
proactive strategies like baby bonds.
Okay, thank you, Angela. You know, I apologize. I did not start off with informing people that you only have 1 minute to testify. But those who have been going to my hearings know I'm very strict about the 1 minute. And if you have written testimony, I have read your written testimony. So I want to make sure that people know that this meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business. I have with me my Vice Chair, Senator Aquino. For those on Zoom, your audio will be muted, video disabled until shortly before it's your turn to testify. Again, you have 1 minute. If there is a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submit written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You will find a link on the status page for the measure. We appreciate your understanding. Remind you that the committee does have your testimony. Those who have come to my hearings know that I have read the written testimony, especially if they're done on time. And I encourage you to use your time to either add additional comments or you can stand on your written testimony. Okay, so moving on, SCR 39, SR 28. Anybody else wishing to testify on baby bonds working group? Seeing none, members, any questions? Okay, moving on. Next up, SCR 49, SR 37, requesting Department of Health to convene a stakeholder working group to make recommendations to enhance meaningful access to healthcare in the state through the provision of language assistance services. First up, we have 49. Hawaii Department of Health in support.
We'll stand on our testimony and support, Chair. Look forward to doing this meaningful work.
Okay, next up, we have Department of Health again. Twice in support. Okay, Office of Language Access. Somebody else in Department of Health, but I see,
Good afternoon, Chair, Vice
Executive
Chair.
Director.
Afirat Banugan, Executive Director for the Office of Language Access. We stand on the written testimony in support of this measure. However, I would like to add one comment that this resolution doesn't have any specify the composition of the working group. But I believe that Quest Integration Health Plan Provider should be invited to be participate in this working group because they are going to be the key player to ensure that all the healthcare professional in their network adhere to as well as follow and comply with language access law. And I'll be available for any question committee may have. Thank you, Chair.
Thank you very much. Okay, next up. Healthcare Association of Hawaii providing comments, page. Thank you very much. Aloha Care and support.
Good afternoon, Chair, Vice Chair, Mike Nguyen with Aloha Care. Thank you for hearing this resolution. Aloha Care is a member of the Coalition for Immigrant Rights, and we just wanted to stand on our written testimony, but thank Senator Aquino and also Senator San Buenaventura for introducing this measure. So thank you.
Okay, thank you very much. Next, we have Hawaii Coalition for Immigrant Rights. Maria, are you present? Please proceed.
Aloha Chair, Vice Chair, Maria Ralihai with the Hawaii Coalition for Immigrant Rights. We are in full support of SCR 49SR 37, and we also support the comments made by the Executive Director of the Office of Language Access. Thank you.
Okay, thank you very much. Next, we have, no, we don't have anyone else registering to testify, but we have written testimony from Hawaii Appleseed Center for Law and Economic Justice in support, Pacific Gateway Center in support, Tarina Wong Pacific Gateway Center in support, Hawaii Children's Action Network Speaks in support, Language Services Hawaii LLC in support. I'm sorry, Don Carisu, HMSA, are you present? Sorry, you did register. Thank you. Nanea Low in support, and we heard from Maria Rolohe in support. Anybody else wishing to testify on SCR 49 SR 37? I see Angela. Please proceed. You have 1 minute.
Angela Melody Young testifying on behalf of CARES in strong support. So my mom is a Mandarin translator at hospitals for those with limited English proficiency. So it's so important. So the Title VI of the Department of Health and Human Services regulations within the Code of Federal Regulations requires recipients of federal financial assistance from HHS to take reasonable steps to provide meaningful access to limited English proficient persons. So it's so important. So we should support it. Thank you.
Thank you very much. Okay, anybody else wishing to testify on SCR 49 SR 37? Seeing none, members, any questions? Okay, I do have. Afira, come on in. Come on up. Isn't Office of Language Access in Department of Health? Well, administratively.
That's correct. Yeah, we are attached agency
Attached.
to the Department of Health.
Okay, so in Department of Health, Lauren Kim, come on up. So both of you folks. So since Department of Health is in support by intent, you folks can convene whichever stakeholders you feel are appropriate, right? And that would be each other, and that would include also MedQuest, because it doesn't exclude anybody.
Yes, as long as the group is manageable in size. So we need to find that Goldilocks number, right? Not too little, not too large.
Right, since Department of Health is in charge, you folks can determine the size.
Oh, yeah, this
We
is,
want.
this is important work and we wouldn't do it without the consensus of stakeholders.
Okay, thanks.
So plans like Aloha Care, Gateway, we're happy to make sure that they're part of this conversation.
Thank you very much. And as you know, although Vice Chair was the one who introduced this is near and dear to our hearts. Would you folks also consider looking into AI digital interpreters type services? Because, you know, there's so many different dialects in the Philippine language, and there's different dialects in the Chinese language. We can't find an interpreter for everybody. So see whether or not, when you convene this working group, if that's a possibility for those types of languages that you folks can't find interpreters for. And I know that being an attorney, that there's already few interpreters of the more common languages to begin with.
Yeah, if I may, yes, we can look into that issue because in later last year, Department of Health and Human Services just issued a new language access plan that is issue about the use of AI in the language access that cover both interpretation as well as the translation. So we can look into detail what the guideline or what is the possibility that the working group can take into consideration.
Yes, and please, I know it's just a request, but if you folks can provide us a report, Senator Aquino and myself would be super interested in seeing whether or not we can introduce legislation next session to promote language access. Okay?
Yeah, and to AP's
And I
point,
see Aloha Care also nodding their head. So, you know, they're a MedQuest provider, so for sure they know
oh yeah,
MedQuest
we've
should be
been
part
talking
of
with
it.
Mr. Nguyen.
Right.
So to AP's point, if we can submit to the chair a preliminary list, if you'd like to just a starter list
Okay.
of participants, and then anybody at the discretion of the ED of OLA or the Director of Health.
Okay.
So happy to do that if you'd like.
Okay, thank you very much.
Would you like me to do that?
Yes,
Okay,
please,
will do.
provide it to us.
Okay, will do.
Thank you.
Chair.
Okay, any other questions? Okay, seeing none, moving on. SCR 64 SR 52, urging the state and counties to prioritize and direct all available resources to supporting coordinated interagency collaboration and public-private partnerships aimed at addressing the ongoing fentanyl epidemic. First up, we have Department of Corrections and Rehabilitations in support. Okay, next up, Hawaii State Department of Health in support. Are you present on Zoom? Please proceed, identify yourself.
Good afternoon, Chair San Buenaventura and Vice Chair Aquino. This is John Valero of the Alcohol and Drug Abuse Division, representing Department of Health, standing on our written testimony in strong support. Thank you.
Thank you very much. Okay, nobody else having registered to testify. Those, wait a second, let me read off written testimony in case they're here. County of Kauai in support. County of Hawaii, Office of the Mayor in support. Kumakahi Health and Wellness in support. Hawaii Island Fentanyl Task Force in support. North Hawaii Community Action Network in support. And we got 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, almost all from the Big Island Fentanyl Task Force, I could see. All 20 individuals, all in support. Anybody else wishing to testify on SCR 64, SR 52? Okay, Angela, you got 1 minute.
Angela Melody Young cares in strong support that there should be collaboration about fentanyl and the fentanyl epidemic. So from the 2019 DEA National Drug Assessment Report, produced in partnership with local, tribal, and federal agencies and integrating reporting from law enforcement, intelligence, and public health offices, this assessment provides an in-depth strategic drug-related intelligence report to inform counter-drug policies and to create priorities and allocate resources. The report says fentanyl and other synthetic opiates primarily sourced from not within the United States. It's sourced from Mexico. It continues to be the most illicit substance abused nationwide. Fentanyl is sold as fake prescription pills to users as the illicit drug or as an adulterant, meaning fentanyl is used to dilute another substance. Fentanyl suppliers experiment with synthetic opiates to circumvent regulations imposed by law. And in regards to fentanyl litigation, Hawaii got $19 million in 2023 from legal claims made against
Okay,
manufacturers.
Thank you very much, Angela.
Yeah.
No one is in opposition to this. So,
Okay, and it's
we're
a
going to move on.
public health
Okay, anybody
emergency.
else wishing to testify on SR 52, SCR 64? Seeing none, members, I'm the only one asking questions, so I don't have any. So I'm going to keep moving on. Next up, SCR 65, SR 53, requesting the Department of Health to assess the registration and monitoring of clean and sober homes. First up, we have Hawaii State Department of Health and Support. Okay, next we have Hawaii Substance Abuse Coalition. Alan Johnson, are you present on Zoom? Please proceed.
Yes, I am. Good
Got 1
afternoon,
minute.
Chair. My name is Alan Johnson. I'm with the Hawaii Substance Abuse Coalition. We know that we need clean and sober homes, but we also know we need some more better management. Now, there's a new guideline from the National Association of Recreational Residents. So what that means, recovery residents, what that means is working in a whole lot of other states. It has better incentives and better help with supporting for permits, which brings in the clean and sober homes into a voluntary registration. And then the Department of Health can better manage with better accountability. So we look forward for this group to see how it would modify the fit Hawaii. And in conclusion, I would just say we need clean and sober homes, but we also need them to be valued as good neighbors. And I think this could do that. Thank you very much.
Okay, thank you very much, Alan Johnson. Okay, next up, we have Austin Salcido in support. Austin.
Hello, Senator. I'm Austin Salcedo. In support of this with amendments, strongly amendments, we need to change the title basically for clean and sober home to group living homes. And I introduced some attachments as well to be incorporated, not only for myself, but for Gina Salcedo as well. Documents like State Health Planning and Development Agency. It's a broken system. Somehow, some way, they lied, deceiving. The document is written there. Section B and C, they lied. Never came before the Waianae Neighborhood Board for a community impact study. Zero. But they approved these operations to happen in 84-1170 Farrington Highway. They're building it right now. This structure is built a 3-story elevator shaft and developing the 3rd floor for a 20-bed unit. This is considered a conditional use permit major. They have declined to do so for an impact study with the city. So we need the city planning department involved into this resolution as well.
Okay, thank
So
you
it's a
very
broken
much.
system.
Okay, thank you very much. Okay, we also have, and if you're going to testify for Gina Salcido, okay, please come on. You have 1 minute, and then after you we have John Valera.
Thank you so much for allowing me to make a statement. The concern about these clean and sober homes, our state departments, it's a broken system. It's not, there's the continuation on the west side is aiding and abetting the situation. How do we solve the problem? By holding the nonprofit organizations who's holding these type of businesses and making sure that my kupunas, my residents, do not have to suffer any type of negligence. And I'm asking with this clean and sober homes that they have to hold liability insurance, not just their own. I'm asking for individual liability insurance for each client they have. Because if they're pushing one of my kupunas down, you're looking at $70,000 for hip surgery. And that's not, I'm asking the title of it to be changed and each individual of the facility that has the client has each liability insurance because my kupunas deserve that.
I wrote it down. Thank you.
unacceptable,
Okay, thank you very
unethical
much.
behaviors. Thank you.
Okay, John Valera, are you present? On Zoom? Okay,
Yes, Chair.
please proceed.
Hi, John Valero with the Department of Health. Just standing on our written remarks in support of this resolution.
Okay, thank you very
Thank
much.
you.
Okay, anybody else wishing to testify on? Okay, I see Angela Meldion, please proceed. SCR 65 and SR 53, yes.
Yes, Chair, thank you. Aloha, Angela Melody Young in strong support on behalf of CARES. So the resolution proposes for the Department of Health to convene an informal working group to discuss the management of substance abuse addiction management homes and discuss possible collaboration with the county and other affected regulators to make sure clean and sober homes comply with county regulations and to encourage registration without using restrictions that are discriminatory. Those that are suffering from substance addiction and alcohol addiction or sometimes polysubstance addiction abuse are at a high risk of mental illness and other psychological disorders. Substance addiction and alcohol abuse exists on a spectrum and maybe mild, moderate, or severe. And those that suffer on the addiction spectrum may suffer from injury, violence, risky behavior, chronic disease, co-occurring physical and mental health disorders. They got plenty addiction homes somewhere in Hawaii that I heard them talk about last year. And they got choke clean and sober homes there. So sober living recovery home management processes should make sure that functions are aligned with the state and county for accountability and for
Okay,
community
thank you very much.
education purposes. Thank you.
Thank you very much. Okay, anybody else wishing to testify in SCR 65, SR 53? Members, any questions? Okay, thank you very much. Okay, next up, we have SCR 81, SR 67, urging the Department of Health to explore avenues to ensure continued access to affordable medications for the state's underserved populations under the 340B drug pricing program and urging Hawaii's congressional delegation and relevant federal agencies to monitor pharmaceutical companies and take appropriate actions to protect the integrity of the 340B drug pricing program. First up, we have 81. Healthcare Association of Hawaii in support.
Good afternoon, Chair, Vice Chair. Thank you for hearing this important measure. We are strongly in support of this resolution. The 340B drug pricing program was established over 30 years ago by Congress to help ensure that vulnerable populations could access healthcare services at certain eligible entities. Those include our safety net hospitals, our hospitals in rural areas, and our community health centers. There are 15 eligible hospitals in the state. 6 of those are actually our HHSC hospitals. They do benefit from the program when they serve eligible patients. But what we are seeing, and it's a national trend, is an effort by pharmaceutical manufacturers to erode the benefits of this program that Congress intended. They are doing that through these contract provisions that are limiting the ability of patients to access their medications at the pharmacies that they would prefer, and that is eroding much of the benefit to our hospitals and community health centers in the state. So thank you for hearing this. We think it's very important and we appreciate your support. Thanks.
Okay, thank you very much. Next, we have Hawaii Primary Care Association, Eric Abe in support.
Yes, hi. The HPCA is in strong support of these measures. We also offer friendly amendments for your consideration. Just want to highlight a couple of points. The 340B program is vital for the sustainability of federally qualified health centers. We are required by law to utilize these savings for either expanded services to Medicaid patients or reduced copays for medications. Because of ambiguities in federal and state law, Medicaid administrators in California and Massachusetts have stopped all 340B reimbursements for Medicaid patients. If that happens in Hawaii, FQHCs would have to scale back services and medications will become more expensive for patients. As such, it is critical for the Department of Health and most especially the Department of Human Services to work together on the 340B issue. For these reasons, HPCA urges your favorable consideration and offers these friendly amendments for your consideration.
Thank you very much. Next, we have Queens Health System in support. Thank you very much. Wahiawa Health Center in support. Kupu Akana, are you present? Please proceed.
Aloha, yes, I am present. Thank you, Senators. My name is Ku'upua Akana. I am the Director of Pharmacy and the Chief Operations Officer at Wahiawa Health. I stand on my testimony and I strongly support this resolution. I am available for questions regarding this at any time. Thank you.
Thank you very much. Next, we have, okay, no one else having registered to testify. We have written testimony from Waianae Coast Comprehensive Health Center in support. William Gu, Pharmaceutical Research and Manufacturers of America in opposition. Anybody else? I see Angela Melody Young. Please proceed. Identify yourself.
Angela Melody Young cares. In strong support, so Congress created the 340B drug pricing program in 1992 to protect safety net hospitals from escalating drug prices by allowing them to purchase outpatient drugs at a discount from manufacturers. The Department of Health is urged to work with pharmaceutical companies to make sure companies uphold commitment to patient access to affordable pharmaceutical by refraining from restrictions that limit and undermine the ability of 340B hospitals to serve patients and communities. So in strong support.
Thank you very much. Anybody else wishing to testify in SCR 81, SR 67? Members, any questions? So I have a question of Paige. Come on up. I think this was your resolution. So did you hear Eric Abe's friendly amendments? Do you have any
Yes.
opposition to that?
We do not. We would be happy to have them
those
added.
amendments, the
Yes.
Governor, Department of Human Services, FQHCs.
Yeah, we certainly want to support our community health center partners.
Okay, thank you very much. Anybody else wishing any questions? Okay, moving on. Next up, SCR 94, SR 80. Requesting the establishment of a telehealth working group to examine the impact of widespread telehealth adoption during the COVID-19 pandemic and identify public policy initiatives at the federal and state level to optimize telehealth utilization as the state transitions out of the COVID-19 pandemic. First up, we have Department of Human Services in support. DCCA, I see Alani. Providing comments.
Yes, we'll send out our written comments.
Thank you. Queens Health Systems in support.
I'll make brief comments.
Come on up, identify yourself. Oh, Dr. Koenig, good to see you in person again.
Good to see you in person. Thanks for having me. Thanks to the chair and committee members. I'm Dr. Matthew Koenig. I'm a neurologist across the street at Queens. And I'm the medical director of telehealth for Queens Health Systems. And I'm a strong advocate for telehealth. I think it's a very important tool for access for patients in our state. For treatment of stroke, it is very well proven to benefit patients through clinical trials and is considered the standard of care. We've seen a 65-fold increase in telehealth adoption statewide, largely through patients using their home devices. And while I think that provides great access for patients, we really need to understand how to optimize the tool for which conditions it's safe and not safe in order to inform our public policy for our payers and as a state. We've done an experiment. We've seen a 64-fold increase in telehealth adoption as a state. We need to go back and look at the results of that experiment and analyze the data. And so I'd ask the state to function in a convener role to help these various payers and healthcare organizations
Thank you, Dr.
get together to share the data. Thank you.
Thank you. Thank you. And I do appreciate the help you've given my mother-in-law. So thank you very much. Okay, next up, we have Ted Kefalas, Grassroots Institute of Hawaii in support. Don Carisu, HMSA in support.
Aloha Chair, Vice Chair, members of the committee. We'll stand on our written testimony in support. Just want to note that we're requesting that either HMSA be added to the working group or at minimum a representative from the health plans. Thank you.
Okay, thank you very much. Okay, anybody else wishing to testify on SCR 94, SR 80? Paige. You didn't.
We did not submit
register.
testimony, and I do apologize. That was on us, not on your
Okay.
staff. But we do want to stand in support of the resolution. We are a named member, and we're very happy to provide as much support as possible for this effort. I know that telehealth has been widely used, more so by hospitals, but also many of our post-acute care members. So we're very appreciative that the legislature is looking at this. Thank you.
Okay, thank you very much. Anybody else wishing to testify on, I see Angela, please proceed.
Angela Melody Young cares in strong support of optimizing telehealth and improving telehealth processes, yet with concerns. So optimizing telehealth includes strategies to understand the telehealth preferences of patients and primary care doctors. It can also include strategies to make sure that they're using correct technology for patients and how to market telehealth services and to review telehealth workflow. So as a concerned citizen, I'm concerned about the data sharing within telehealth. For example, if medical records are going to be shared via telehealth, what if data is breached, right? So I'm going to go back and refer to the HIPAA privacy rules, which creates a national standard to protect medical records, and it does set a limit and condition on the uses and disclosures that may be made of such information without authorization. Epidemiological information is used to plan and evaluate strategies to prevent illnesses, and is a tool for management of public health. So that's a concern. Yeah.
Yes. Thank you very much. Okay, anybody else wishing to testify on SCR 94, SR 80? Seeing none, members, any questions? Okay, Queens, come on up, Dr. Kernan. I believe this is your resolution. So you heard HMSA wanting to add healthcare health plans of Hawaii, or HMSA, and you heard BC, well, you didn't hear, but they have written testimony, BCCA wanting their own representative. And do you have any questions as to adding those two representatives into the working group?
No, I think that would be very appropriate.
Okay, thank you very much.
Okay, thank you.
Okay, any other questions? Seeing none, moving on. Okay, SCR 137, SR 118, requesting that a task force be convened to develop a Norwegian-based public facility model designated to ensure the well-being and safety of dementia patients. Okay, so for SCR 137, we have State Council on Developmental Disabilities in support.
Yeah, we'll stand in our testimony, actually, offer comments.
Oh, comments, right. I see Carolyn Kadirao in back providing comments.
Good afternoon, Chair, Vice Chair, members of the committee. Thank you so much for hearing this measure. The Executive Office on Aging is offering comments. While we support the intent of this measure, we don't feel that it's necessary to convene a task force. We have a ADR, Alzheimer's disease-related dementia strategic plan that we'd be happy to look at this model as one of the strategies in addressing Alzheimer's disease and related dementias. And I'm available for any questions. Thank you.
Okay, thank you very much. Okay, next we have no one else having registered to testify. We have Office of Wellness and Resilience, Office of the Governor providing comments, Alzheimer's Association providing comments, AARP in support. Okay. Members, any questions? So I have a question. Carolyn, come on up. So there is HB 2224, which is a Kupuna Caucus bill on long-term care planning. Do you believe that that could include at least a discussion of this Norwegian-based public facility model?
That's another strategy. Yes, that would
Okay.
be something to look
Okay.
at.
Okay, thank you very much.
Thank you.
Okay, anybody else wishing to testify or questions? Okay, moving on. SCR 175, SR 115. First, requesting the Department of Human Services to report on the cultural and therapeutic services provided by community-based organizations at the Kawailoa Youth and Family Wellness Center. First up, Hawaii State Council on Developmental Disabilities. Sorry, 175. Oh, not you. I'm counted wrong. Opportunity Youth Action Hawaii and support.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Hannah Lisiak, and I am a master's student here today on behalf of Opportunity Youth Action Hawaii. I first want to thank Senator Aquino for introducing this reso, so thank you. Opportunity Youth are young people who are between the ages 16 to 24 years old and are disconnected from school and work. This developmental time period, also referred to as emerging adulthood, has great potential for individual growth through exploring independence and life opportunities. We are in support of this resolution. Opportunity Youth Action Hawaii is comprised of youth-serving nonprofit organizations based in Kailua on the Kawailoa campus. The organizations have come together to reduce the harmful effects of poverty, homelessness, and incarceration, promote equity in the justice system, and improve resources to address adolescent and young adult mental health needs. Please support this measure. Thank you.
Okay, thank you very much. Anybody else? No one else having registered to testify? Anybody else wishing to testify in SCR 175, SR 151? Come on up. It's okay, identify yourself.
Aloha, Sean Kanai'aupuni. I'm the Chief Executive Officer of Partners in Development Foundation. And thank you, Chair San Buenaventura and Vice Chair Aquino and members of the committee for this time. Partners in Development runs the Kupa'aina Farm, which is one of the community providers of services, these important services happening and really transforming opportunities for young people who are severely at risk, facing trauma and other challenges in their life, including justice involvement. Our collaborators alongside us, so we run the Kupa'aina Farm, allowing youth to learn about food and food science, but also having the chance to restore and heal, and finding that positive pathway in life for both their rehabilitation and their restitution and becoming positive community contributors. We're also a part of the Opportunity Youth Action Hawaii and urge strong support for this resolution, allowing us to tell our story and also look at ways to make sure that this powerful work endures.
Thank you very much.
Thank you.
Okay, anybody else wishing to testify on? Okay, Angela, please proceed. You have 1 minute. You don't have to testify, but.
Oh, no, I'm just trying to read.
Okay, come on, you have 1 minute.
Angela Melody Young, testifying in strong support on behalf of CARES. So the Kawailoa Youth and Family Wellness, Kawailoa? Kawailoa. Sorry, Youth and Wellness Family Center is for at-risk youths. And I think it was originally the Hawaii Youth Correctional Facility, which is a very peaceful setting for the juvenile correctional center. And it's going through the physical and spiritual transformation, right? The Hawaii Youth Correctional Facility of becoming the Kawailoa Youth and Family Wellness Center. So there's going to be like a new vision of realizing Hawaii's juvenile justice system. So all the kids from the center go through poverty, abuse, victimization, as well as drug addiction and mental health issues. So by providing opportunity for them,
Angela, thank you
it
very
can prevent
much.
them from the adult
Thank
criminal
you.
justice system. Thank you.
Thank you very much. Okay. Anybody else wishing to testify on SCR 175, SR 151? Members, any questions? Okay, moving on. SCR 177, SR 153, requesting the Department of Budget and Finance to work with the State Council on Developmental Disabilities to enhance the Able Savings Program by promoting it to all individuals who may qualify. First up, we have Hawaii State Council on Developmental Disabilities in support.
Thank you, Chair. We'll send our testimony strong support.
Okay, thank you very much. Carolyn Cutterell, Executive Office on Aging in support.
Thank you.
Thank you. Louis Urchik, Hawaii Disability Rights Center in
Yes, thank
support.
you. Yes, briefly, Senator, pretty similar testimony to what I said the other day on the bill. ABLE is a great program. I can tell you, I mean, I was around here when the state passed the ABLE Act, and maybe it's gotten a little better, but I do know that in the beginning, BNF, let's say, needed to be prodded along, shall we say. And so I think it never hurts. It's always a good idea for the legislature to reassert to the administration the importance of carrying out state law and state policy. So whatever encouragement you can give to BNF to work together with the DD Council and others. There's so many people who are eligible for ABLE accounts that are not currently enrolled. And so whatever you can do to help would be great. Thank you.
Okay, thank you very much. Okay, next we have Kylie. Come on up.
Good afternoon, Chair, Vice Chair, and committee members. My name is Kylie. I'm in strong support of this bill because ABLE account is very important with people with disability to save up more money without hurting the Social Security asset over $2,000 limit. Please pass this bill and please let me know if you have any questions.
Okay, thank you very much. Okay, anybody else wishing to testify on SR 153, SCR 177? Come on up, Angela.
Angela Melody Young cares, in strong support of the ABLE account.
Hey, that's it? Oh, surprising. Thank you. Appreciate it. Anybody else wishing to testify? SCR 153. SR 153, SCR 177. Seeing none, members, any questions? Okay, moving on. SCR 188. Requesting the Department of Human Services to immediately cease intercepting Social Security payments for children in foster care. First up, we have Department of Human Services. Daisy, come on up.
Good afternoon, Chair, Vice Chair, and member of committee. I'm Daisy Hartsfield, Social Services Division Administrator on behalf of Director Betts for the Department of Human Services. The department did submit written testimony appreciating the intent of the resolution as well as offering comments. I did want to emphasize that the funding we received last session has allowed us to cease using any Social Security payments for any foster board reimbursements for children who do receive the Social Security benefits. And I did want to let you know that the funding is included in our base budget. So we'll be able to continue to cease using Social Security benefits to pay for their foster board payments.
Okay, thank you.
Thank you. I'm available for any questions.
Okay. Next, we have Stonewall Caucus of the Democratic Party of Hawaii. Michael Galoyo, are you present on Zoom?
They're not present on Zoom, Chair.
Next, we have Marilyn Yamamoto in support, Dara Carlin in support. Anybody else wishing to testify on SCR 188? Members, any questions? Okay, can we go on to decision making? We have, okay, so first up, for SCR 15, SR 7, Chair's recommendation is to defer this due to SB 2285, SD2, HD2 is continuing to move, putting planning and data sharing into SHPTA. Any comments? Nope. Moving on, SCR 34. Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, SCR 34, recommendation of the chair is to pass as is. Okay, Chair votes aye, Vice Chair votes aye. Senator Keokolole. Aye. Senator Shimabukuro is excused. Senator Awa is excused. Recommendation is adopted, Chair.
So for SCR 39, SR 28, Chair has read Department of Human Services comments about the number of other savings programs that are available but are not being taken advantage of, so we are going to defer this. Okay, for SCR 49, SR 37, we've had meaningful discussion. Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SCR 64, SR 52, Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation of the Chair is to pass SCR 64, SR 52. Okay, as is. 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
For SCR 65, SR 53, noting that the group homes referred to by the witnesses is in the body, we are going to accept the proposed amendment of changing the title to requesting Department of Health to assess the registration and monitoring of clean and sober homes and group homes as defined by HRS Section 46-4. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Thank you very much, Chair. SCR 65, SR 53. Okay. Passed with amendments. 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so for SCR 81, SR 67, Chair's recommendation is to pass this with amendments. We're going to accept Hawaii Primary Care Association's proposed amendments to amend the title and the body. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, any reservations? Any noes? Recommendation is adopted, Chair.
Okay, for SCR 94, SR 80, we are going to accept DCCA's proposed amendment and HMSA's oral amendment to add 2 representatives, 1 from DCCA and 1 from a representative from the health plans of Hawaii. Any comments, questions, or concerns? Passed with amendments.
Thank you very much. 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SCR 137, SR 118, Chair notes as stated in testimony that HB 2224 HD2, which is a long-term care planning bill, is moving forward. So we're going to defer this due to a bill actually planning this. Any comments? Seeing none, moving on. SCR 175, SR 151, Chair's recommendation is to pass this as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, passing as is. 3 members are present. Any reservations? Any noes? Recommendation is adopted.
For SCR 177, SR 153, Chair's recommendation is to pass this as is. I am going to note to the advocates that as much as we like this, Budget and Finance did not comment on this, so it's somebody's going to need to ask them to be part of this collaborative effort. Okay. Otherwise, as is. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, passing as is. 3 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
So for SCR 188, Chair's recommendation is to pass this with amendments. We are going to strike out every phrase that says immediately cease to continue to cease. To note that DHS is not intercepting Social Security payments at this time. Any comments, questions, or concerns? Seeing none, pass with amendments.
Okay, with amendments, any reservations, any noes of the 3 members present? Seeing none, recommendation is adopted, Chair.
Okay, thank you very much. We are adjourned.